Really started out with the EKG courses, the yellow, blue, and black belt, primarily because our program director was giving those lectures early on during intern year. And when he saw what Medmastery had available, he decided they were doing it much better than he was. And so that was kind of where it all started, I think, with the EKG. We are very invested at our residency program in ultrasound. Our interns, get access to ultrasound, day one. So one of the ways that we kind of onboard them is using Medmastery's POCUS Essentials. They have to do that during orientation so that they're ready to go when they hit the door. Another way we use Medmastery is we use a lot of the imaging courses. We have a hard time getting radiologists and some other folks to lecture to our interns. And so that has really bridged that gap. Their basic knowledge improves after they're, looking at the courses. So encourage them to use the platform for their own study purposes in areas that they feel that, they might be deficient. So when I'm going in and reviewing their completion, that kind of thing, I notice, that they're using a lot of the other courses. I think the lack of feedback is probably more noticeable than, actually getting feedback from them. The fact that they're not complaining about it is probably because if there's anything that they don't like, they're sure to tell me about it. So I think Medmastery is probably the only platform that we use that we don't get complaints. And that's saying a lot, so. Absolutely, I would recommend Medmastery, and also just how much the platform has grown in the years since we've had it. They're just adding new things all the time, and so that's pretty exciting. Advantages to Medmastery is that it's broken into short videos. And then, quizzes. So it's like easy for our residents to go in. If they don't have a ton of time, they can go in, they can look at specific topic areas, they can get that knowledge. I think that's what makes it nice, is that, the topics are very clearly defined. You can look at the subtopics and know exactly where you need to go to get the information that you're specifically looking for. So they can really target what they want very quickly. I haven't found any. We are like big Medmastery champions. So you do the topic so well that we just wish, whenever there's a resident who wants to learn about a specific thing, we just wish all the topics were there.